Live has all of your favorite music, and you can listen for free. Whether you hit play on one of our hundreds of curated music stations or create your own custom artist radio station, you'll find the music you love on Live by Live. Visit livexlive.com or search LiveX Live in the App Store or Google Play and listen for free now.
Welcome to the Beverly Hills Plastic Surgery Podcast. This is Dr. Jay Calvert. Dr. Avello and I are sitting here today talking about a case that we just did. Dr. Avello, how are you?
I'm doing excellent. How are you?
I'm good. I noticed that this is some pre-birthday celebration going on here.
Yes. I was going to be really good this week and eat my salads and work out and save the birthday extravaganza for the actual birthday. And I'm realizing that's just not going to happen. It's going to be like a birthday week of cake and goodies.
Judging by the thick coating of cream cheese frosting on that bundt cake, I think it's not going to happen.
It's not going to happen. No, I think that today starts the birthday week celebrations.
You know what you got to do? You just got to double sesh with your man Justin over at Equinox. That's what you got to do.
That may be what has to happen.
He's gonna need to get involved.
Yes, I wonder if he'll be there at 4 a.m. No.
He would actually, knowing him.
He would.
I think just in the brief time that I've chatted with him, I think he'll do what you got to do. We're going to talk about a case that we just did and something that I've been doing, for quite some time, but it's become a major part of plastic surgery, which is facial feminization for transgender patients.
Right. And this, yes, you're correct. This is a case we just did recently. And I have been seeing a decent amount of transgender patients over the past couple of years. And I think a lot of plastic surgeons are seeing a similar trend. And this is in part because over the past few years, insurance requirements have lifted in terms of what they provide coverage for. So now it is a requirement. It's a federal requirement that insurance companies do have to approve certain surgeries for transgender patients. And this could be male to female, female to male. But it is a requirement now the same way they would cover, open heart surgery or gallbladder or whatever. And there's also a growing understanding and recognition of gender dysphoria in the transgender population. And so it's becoming more popular among these patients to seek out surgery. So I think those are the reasons we're really seeing a lot more of these cases. And so when you're talking about transgender surgeries, there's a whole host of surgeries that you can do, and we could spend multiple podcasts talking about the different options. But the one that we are talking about today in particular is facial feminization. So this is a patient who has a male facies and wishes to look more female, and the different options that are available to do that.
Right, and every case has to be customized because, number one, people look very different. Different aspects are more masculine or more feminine, right, depending on the way that the patient is built. And Correct. The options, I think, are extensive. But what you want to do is and how I kind of approach this is I just ask them, what bothers you? What would you like to see? Give me the directions for what will make you feel more comfortable, more at home, more yourself, based on what's going on for you aesthetically.
Yeah, and patients are usually pretty good at telling you exactly what bothers them about their face. But then there's also patients that really don't know. They don't have the eye to see, what needs to be done. All they can tell you is that I look like a man and I wish to look more female. But they couldn't really tell you specifically how that could happen. They just know that it's possible, and they ask, just do whatever you think needs to be done. And
do your worst.
Do your worst. And to be fair, there are, plenty of papers and studies in the plastic surgery and facial plastic literature that specifically evaluates what makes a male skull typically male and what a female skull